Gonorrhea. Gonorrhea is a sexually transmitted disease (STD) caused by infection with the Neisseria gonorrhea bacterium. Neisseria gonorrhea infects the mucous membranes of the reproductive tract, including the cervix, uterus, and fallopian tubes in women, and the urethra in women and men.
Now let's look at the current cases of Neisseria gonorrhea in the United States. The rate of reported cases by sex are based on 2010 to 2019 records. As we can see in 2019, there are a total of approximately 616,000 cases of gonorrhea were reported to the CDC, which is known as Center for Disease Control and Prevention. It is the second most common notifiable condition in the United States for that year. Rates of reported gonorrhea have increased 92% since the historic low in 2009. During 2018 to 2019, the overall rate of reported gonorrhea have increased 5.7%. Rates increased among both males and females in all regions of the United States and among all racial ethnicity groups. The higher case rate among men and the magnitude of recent increases suggests it is either increased transmission, increased case ascertainment, or both. The concurrent increase in cases reported among women suggests it could be either increases in heterosexual transmission, increased screening among women, or both. Based on the statistic, we can know that in 2019, there are approximately 3,000 gonorrhea cases were reported in Malaysia.
Causes of gonorrhea. This sexually transmitted disease comes from a bacteria called Neisseria gonorrhoeae. It spreads through sex, but a man does not have to ejaculate in order to pass it on to their partner. You can get gonorrhea from any kind of sexual contact, including anal intercourse, oral intercourse, vaginal intercourse. As with other germs, you can get the bacteria that cause gonorrhea just from touching an infected area on another person. If you come into contact with the penis, vagina, mouth, or anus of someone with gonorrhea, you could get it. Women who have gonorrhea can pass it to their baby during a vaginal delivery. Babies born by C-section can't get it from their mother. These germs can't live very long outside the body, so you can't get gonorrhea by touching objects like toilet seats or clothes. Signs and symptoms of gonorrhea. Gonorrhea symptoms in men usually include burning when you pee, painful or swollen testicles, white, yellow or green discharge from your penis. Most women does not have symptoms. If they do, they are often mild. You might mistake them for something else. They include burning or pain when you pee, bleeding between periods, more vaginal discharge that is typical, pain in your belly, pain when you have sex. Gonorrhea infection in your rectum or rear end may cause bleeding, discharge, itching, pain when you poop, soreness. Gonorrhea can also infect your eyes, throat, or joints. You can also be infected but have no symptoms.
Sampling technique for gonorrhea. This technique should be done with sterile swab. How to collect an endocervical sample. First, peel open the sterile pouch Remove plug from sterile tube and discard. Remove swab applicator and collect specimen by rotating the swab against the wall of endocervical canal several times. Rotate the swab against the wall of the endocervical canal several times for 20 to 30 seconds. Withdraw the swab without touching the vaginal surface. Insert swab into the transport tube. Record patient information in space provided on the label. Transport specimen to laboratory to be processed. How to collect a urethra sample? First, gently insert the swab into the urethra. Rotate the swab in one direction for a minimum of 10 seconds. Withdraw the swab. Braid the swab handle at square breadboard line. Label the wire with appropriate patient information. See the transport tube, allowing the specimen to be exposed to the appropriate transport media. How to collect a rectal swab? Insert a sterile swab approximately 2.5 cm into the anal canal. Move swab from side to side in the anal canal. Allow swab to remain 10 to 30 seconds for absorption of organisms onto the swab. Remove swab and insert into a wire containing 1 to 3 ml of viral transport media. Label the wire with appropriate patient information.
Next, we move on to the diagnostic test. Gonorrhea diagnostic test can be divided into two types, presumptive test and confirmatory test. Presumptive test includes direct smear, culture, microscopic observation, and identification test of Neisseria gonorrhoeae. Meanwhile, confirmatory tests can be subdivided into biochemical tests, serological tests, chromogenic tests, and nucleic acid tests. Now, we will go more detail on how the tests are performed. For culture tests, we use chocolate agar and selective agar containing antimicrobial agents that will inhibit the growth of commensal bacteria and fungi. These culture plates will be incubated in 35 to 37 in a moist atmosphere enriched with 3 to 7% of carbon dioxide. Longer than 48 hours because most old cultures will not survive in storage conditions. In microscopic examination, Neisseria gonorrhoeae will appear as gram-negative kidney-shaped diplococci in a polymorphonuclear leukocytes in male patients. Presence of extracellular gram-negative diplococci is an equivocal finding that must be confirmed by culture or nucleic acid tests. For microscopic examination, the endocervical smear from female or rectal specimens are more difficult to interpret due to the presence of other gram-negative coccobacilli. For the identification test of Neisseria gonorrhoeae, there are two tests that commonly performed, oxidase test and also catalase test. For oxidase test, use 1% of aqueous solution of NNNN tetramethyl 1,4-phenylenediamine. As a positive result, we could see a dark purple color change within 10 seconds. In catalase test, we use 3% hydrogen peroxide or superoxole. In a positive sample, bubbling reaction will be seen within 1 to 2 seconds. Weak bubbling or bubbling after 3 seconds indicates a negative reaction. Next, we move on to the confirmatory test. First, we're going through the biochemical test for Neisseria gonorrhoeae.
In this test, the ability to ferment different sugars is traditionally determined using the conventional cysteine trypticase agar medium CTA containing 1% of sugar. This method is based on fermentative species and it is not sensitive enough to detect acids from oxidative species. The rapid identification method Neisseria is a commercially available rapid acid production test that compares well with the conventional method but may also differentiate between Neisseria gonorrhoeae and Neisseria cinerea. For serology tests, there are three options tests that we can run. First one, fluorescent antibody test. In this test, the fluorescent isothiocyanate labeled monoclonal antibody in the micro-tract Neisseria gonorrhoeae culture confirmation test reacts specifically with Neisseria gonorrhoeae. In the positive result, Neisseria gonorrhoeae will show apple green fluorescent staining of kidney-shaped diplococci. Second one is the coagulation test. This test can be performed on primary culture where the cell suspensions are boiled and combined with monoclonal antibodies that detect heat-stable epitopes on the pore, outer membrane proteins, and detection reagents. As a positive result, coagglutination with test reagents will form. The third option is calorimetric test. The mixture of antigen-antibody complex is passed through the filtration units and appears as a red dot on the filter that indicates a positive reaction. The next test is chromogenic enzyme substrate test. It is based on the presence of performed chromogenic enzymes in the culture. This test requires heavy inoculum of the organism grown on selective medium to permit rapid speciation of isolates. The final confirmatory test is nucleic acid test. The frequently method used in nucleic acid test is the amplification method, or commonly known as polymerase chain reaction. Using this method, the target sequence for the detection of Neisseria gonorrhoeae is the DNA methyltransferase gene. After the sample collection, the swab can be transported in wet or dry tubes. The result of PCR method will be interpreted by the electrophoresis method. In this gel, there will be 6 lanes in use. The first lane is for the control size of Neisseria gonorrhoeae. From the second until the fifth lane are where the sample is loaded. As for lane 6, it will be loaded with leathers within 100 base pair range. For the test accuracy, the last lane will contain the negative control. For this result, the patient samples from lane 2 to lane 5 are positive.
With the advancement of diagnosis and treatment for gonorrhea, there is now an awareness of the spread of this microbe. This problem of gonorrhea is still prevalent in the United States, and in order to improve and find better means of prevention,